Okay. Hello, everybody. Welcome to this week's VAR on Air segment. My name is Peter Vu, and I'm one of VAR's interns for 2024. This week, our segment will be covering public health concerns through the perspective of the Vietnamese community, and we are joined by actually one of our very own staff members here at VAR, Jacob Huy Ngo. Just a note before Jay and Jacob introduce themselves. Unfortunately, for future segments, we will no longer be joined by Nguyen Pham, who you guys might recognize from previous segments. Nguyen has decided to take a step back from VAR as an organization to pursue a doctorate degree. We at VAR look forward to what he has in store for the future and are so grateful to have had him on our team. Okay,
Thank you,
passing.
Peter. Thank
Yeah.
you. So my name is Jay, and I am also one of the recurring co-hosts alongside Peter. And now Peter and I are kind of taking more of a leading role in VAR on Air since Guing has decided to take a step back. And like Peter said, we're going to be learning more about public health concerns through the lens of the Vietnamese American community. And so, Jacob, if you could introduce yourself.
Hi everyone, my name's Jacob. I'm currently a community health worker with FAR, but aside from that, I am also a full-time industrial hygienist, which looks at occupational health and how we can understand exposures and controls to keep our working community safe.
Thank you, Jacob. So since we're here today to kind of educate ourselves about public health concerns and the different circumstances and nuances of working as a Vietnamese American, I figured that a great place to start would be the Vietnamese dominated nail salon industry. So could you potentially provide insight into the major public health concerns or occupational hazards that nail techs face?
Yeah, so before that, there's a term that we need to talk about, and it's called the social determinants of health. And it's a really important term in public health. They're essentially a list of factors, not necessarily physical factors, that can influence health outcomes for individuals or communities, right? So these may consist of things like educational status or educational attainment, how easy it is to access education in your area, your zip code, so where you live, how you live, what kind of house do you live in, or do you even have a house? Any basic needs access, so access to food, clean drinking water, housing, your environments. And this kind of plays in part with zip code. So do you live in an area where air is regulated and there aren't a lot of factories nearby that are polluting the air? Or are you living in an area where it's really unkept? There's a lot of garbage everywhere, which may lead to things like pests and rats that may also bring disease, and so forth, right? So all of these factors are all factors that affect someone's health holistically, right? And so how this relates to really the nail salon industry is that nail salon workers have so many social determinants that affect their health aside from the actual job itself, right? So we need to think about finance. So oftentimes, a lot of nail salon workers are working long hours, low wages, right? Um, we need to think about citizenship status. So things like, are they an immigrant? Are they a refugee? Do they have a U.S. citizenship? Things like that. Are they born in the US? Are they did they recently move to the US, or have they migrated to the US because of things like the Vietnam War? And then also educational status. Did the nail salon worker finish high school, or did they not attain any education in the US? Things like that. Race and ethnicity, obviously, that is a really big factor to a nail salon worker health. And things like language, can they speak English? Do they only speak Vietnamese? How well can they understand English? And also just family circumstances, right? So things like, how many children do they have? Are they supporting their grandparents or their in-laws? How large their family is that they need to support, or are they a single working parent? Um, and things like that, right? So it's important to know that oftentimes a lot of people don't think about it, but racism and discrimination really affects your health and really affects your mental space as well. And segueing that into more of the occupational hazards, Typically, in occupational health, we tend to categorize hazards into four areas. So it's physical, so that includes things like noise, heat, radiation, ergonomics. And for nail salon workers, definitely heat, especially since we're going into summer. Nail salons may not have proper air conditioning, so they rely on just keeping the doors open for that cool breeze. But the heat can still fester in that nail salon and things like ergonomics, which is essentially how your body moves while you're working or how it's positioned. So you'll see a lot of workers tend to be hunched over while they're working on nails, or they'll be sitting for extended periods of time without taking a break standing up. Um, and there might be pinch points where they're leaning or using equipment that requires pinching their fingers, and over time, the muscles in your fingers might degrade from constant pinching, things like that. So that's physical. The next is chemical. So it's obviously like your chemicals that you see in every single nail salon. There's a lot of common chemicals like acetone for like nail polish remover, but there's a lot of advocacy work actually with something called the toxic trio. So the common three chemicals that are typically seen in all nail salons. So they're phthalates, toluene, and formaldehyde. And those are the three that typically a lot of workers tend to know or tend to advocate for proper protection against, because all those chemicals, for if you're exposed to for a long duration of time over years, may result in a lot of long-term health effects like cancer or respiratory diseases or ailments, things like that. And so that's chemical. Next is biological. So biological involves things like COVID-19, diseases, viruses, things like Legionella. Recently in the news, I think a year or two back, there was a Legionella outbreak in a nail salon in a nail salon shop because the spas that they were using for when people get pedicures weren't maintained properly. And so a lot of workers ended up contracting Legionella from that. And then things like nail dust, since you're filing nails, that the dust can just go into the air and make things harder to breathe, right? So biological. And then last, a lot of people tend to overlook is psychosocial. And we've seen this in the news a lot, where there's violence against immigrant workers, right? So there've been numerous accounts of nail salon owners getting robbed by gunpoint in a lot of different counties and states, or just customer complaints, right? It's a service industry, and all that complaining and maybe not speaking the language really well can lead to a lot of psychosocial stressors, right? And so those are the main kind of things that you may find at occupational or that are occupational hazards in nail salons, but definitely not all inclusive. There's so much more, and each nail salon is different, right?
All right, yeah. Thank you for that first response, providing insight into the major public health concerns and occupational hazards that can be seen, like for nail salon workers and nail technicians. I'm gonna segue it into our next question, which is, are there any health concerns specific to Vietnamese communities that might be exacerbated by nail salon work?
Yeah, so there's a lot of health concerns in general in regards to nail salon work that I kind of touched upon earlier. Um, And so the common things that we typically see in nail salon work are respiratory diseases and issues, things like asthma, having trouble breathing, and even one of the worser outcomes, having forms of like lung cancer or other types of cancers, respiratory cancers. Another common thing we see are dermal issues. So oftentimes we see skin sensitivity from working with these chemicals very often, rashes, maybe even chemical burns if it comes to that. But also other like short-term, in the moment kind of symptoms tend to be a lot of headaches, lightheadedness, nausea, tiredness, things like that. And it's interesting because I read a research paper published back in 2020, a long time ago, and I just remembered it while I was prepping for this, that there was a study that showed that urine samples of Vietnamese nail salon workers contained twice as much the level of phthalates, which were one of the toxic trios, compared to the general population of Asian Americans in the US, right? So then now it becomes this reproductive issue, right? Because phthalates are an indicator of reproductive, let me get this. An increase in exposure to phthalates may lead to things like reproductive cancers, like cervical cancer. And that might be why Vietnamese women have such a high rate of reproductive cancers in the US, like cervical cancer, because the workers that work in these nail salons tend to be Vietnamese women, right? And then I kind of want to also talk about, well, a lot of people say, why can't they just work with other chemicals or substitute it, right? But you have to think back to the population. A lot of these workers work long hours for low wages to survive, right? And many accept the fact that they'd rather be exposed to these chemicals for more than what's allowable because they need to keep their families afloat. So it's almost a survival game, right? And so all these things really are impacted by um, all these factors really impact Vietnamese communities and especially those who work in the nail salon industry, because there's such a huge discrepancy with what Vietnamese nail salon workers experience versus other Asian American populations in the US.
Thank you, Jacob. So in my previous question, you kind of touched base a little on like occupational hazards, especially when it comes to psychosocial, was it? And I'm interested in hearing your or just like some insight into how language and culture might affect a nail tech's approach to occupational health issues. Like how might their fluency or lack of fluency in English or just Vietnamese culture in general affect their willingness to speak up about health concerns?
Yeah, and I think this definitely goes two ways, right? So first is like it's a service industry, so they need to be able to communicate with their clients because without clients, they won't bring money to their nail salon business. And so it becomes a frustrating moment when a nail salon worker who isn't fluent in English is trying to communicate with a customer that only speaks English. And with that psychosocial stress, where mayhaps the customer might misunderstand or the nail salon worker doesn't really understand what the client wants, um, it becomes almost as if they aren't really being heard. And so they're kind of accepting the fact and being passive. So I've seen a lot of videos out there on social media where a lot of clients are there's like a film or something where a client is berating a Vietnamese nail salon worker because they're like, oh, you didn't get what I asked for right, and I don't even understand you when you ask me questions. And it's really hurtful to hear those things, and but you can't do anything about it because they're like, well, I need to live, I need to survive, right? So it's really disheartening for me to watch those types of videos and to hear these types of stories because they would rather say I'm sorry and apologize for something that might not be something they might not have done because they know that apologizing might bring that customer back to that business and then that will bring money because in the end they do need to make an income and it's a really twisted way of how Vietnamese nail salons may work because bosses might advocate for that. They're like, oh, if a customer is giving you trouble, just say that you're sorry immediately and that you will try to fix it because getting that money in order to survive is more important than your own mental well-being and your own dignity at times for them. And so that's like one major part of it. And another is that they might not even be aware of what they're exposed to. So it's like that kind of idea, like who cares about health when you need to put food on the table? And so it's interesting because in a lot of larger companies, um, there's always health and safety training where they talk about the chemicals that are present and proper protection you need when using these chemicals. And they have these things called safety data sheets, which are essentially sheets that write information about the chemical and handling procedures and the health effects that can be associated with that chemical after long-term use. But many nail salon workers aren't even aware of what these safety data sheets are, right? Or aren't even aware of what chemicals are inside the nail salon products, right? They just know this product does this, and I need to use this to do this. right? And these chemicals, you can't really translate them into Vietnamese. Like you can tell someone, um, oh, this product has toluene. And a nail salon worker would be like, I don't know what toluene is, but I do know that this product will achieve a certain effect for a client. And because of that, like, especially with mom and pop shops where they might not be able to really know what they're exposed to, this becomes a huge barrier in trying to help them understand their health, right? And also their willingness to speak up about health concerns because they aren't aware of it in the first place. And so you're trying to balance a game of, oh, what kind of workers' protection can we provide for nail salon workers um, that doesn't necessarily impede on their business, right? You can't tell a nail salon worker, oh, while you're working with these nail salon products, you need to wear a respirator in order to capture any vapors that come from the nail salon products. Who would go into a nail salon shop with all the nail salon workers wearing half-face respirators like it's some kind of chemical plant, right? And so a lot of workers are really hesitant or even flat out say, no, I'm not going to do that because how is that going to bring any business? People are going to be scared when they walk in. And so we have to think about how else can we protect them. And then also it turns into a workers' rights issue because who can they turn to for help, right? Sometimes a lot of their bosses may forego a lot of worker protection requirements, like shorter having very short or no breaks at all, not paying fair wages, um, and also maybe not being able to pay workers on time or going without pay for years or maybe months as a debt for the nail salon. So it's a lot of different types. It's a very nuanced workplace, right? So a lot of it is, oh, I just need to be quiet and do the work I need to do because that's the only way I'm going to get paid or even will get paid in the future. And I don't really care about whether or not I'm getting exposed to ABC chemicals or this rash will go away in a few days. I just need to wear a bandage or glove over it because working brings food to the table. Working keeps their family afloat.
Yeah, it is honestly sad to see how much that these people, these workers have to like cater to whatever people treat them like or cater to like using these chemicals because they are after like putting food on the table, as you said, for their families and like that's their only source of income and like they have to do it or else things just will go downhill for their families. So this transitions to my next question because like these workers do have to put up with this, but are there any initiatives that exist to educate these Vietnamese nail salon workers about the health risks? And are there any specifically in their native language to help them?
Yeah, so while I was doing some work back in my undergrad, there was this group called the California Healthy Nail Salon Collaborative, and it's based in the Bay Area. And they're essentially a network of nail salon workers and researchers and community health workers and other important stakeholders um, to really promote nail salon worker education, health, and safety. And they do these things through things like civic engagement, voter engagement, outreach and leadership development, policy, advocacy, workers' rights. And they do this in both Vietnamese and English. So oftentimes you'll see a lot of the employees or volunteers with the Healthy Nail Salon Collaborative go out and canvass to different nail salons and speak to them in Vietnamese, being like, oh, do you understand your rights to work? Or, oh, this California has a bill that's trying to achieve A, B, and C, and this affects nail salon workers because A, B, and C. And so having this education in Vietnamese and trying to make it sustainable by having other Vietnamese nail salon workers kind of share their story and advocate their needs also may inspire others to do the same, right? It's one thing to have someone who doesn't look like you tell you what to do, but it's another to see people of your community be passionate and advocate for your needs, which inspires you to do so for yourself, right? And so they're a really cool organization. I love them a lot. They provided me a lot of resources when I was still learning more about the nail salon industry. And even in the city and state level, there are programs that provide resources. So, like for example, I saw that San Francisco had this program. It's called the Health Nail Salon Program. And the California Department of Toxic Substances Control has a healthy nail salon recognition program. But all these programs are mostly in English, right? And so it becomes that barrier where, oh, we have these programs from a city and a state level, but sometimes they're not accurately translated to the Vietnamese population or even a language for that population, right? Because we know that in the South Bay, there's a lot of Vietnamese nail salon workers, but in other states, for example, in New York, there's a huge population of not just Vietnamese nail salon workers, but Korean, Hispanic, Chinese nail salon workers as well. And so I really encourage a lot of the city and state programs to be translated and have community health workers understand those programs and then go out to the community to translate for the community about these programs. Like, oh, did you know that you're entitled to this, this, this? Or, oh, did you know that if you do this, you'll be recognized by the state and do this, right? And so I think there is work being done, but obviously there's always more work that needs to be done. Um, with helping Vietnamese or nail salon workers in general know about their health risks and what's out there for them.
Yeah, thank you. And one more question from me is beyond the so we've covered a lot on like nail salons, but beyond nail salons, what other industries with a high concentration of Vietnamese workers have significant public health concerns?
Yeah, so nail salons are definitely a very large industry with Vietnamese workers. But I think it's more so the service industry in general. So that includes things like business. So we see a lot of hairdressers um, that might face a lot of ergonomic issues, as I said before, with cutting hair or using hairspray or other hair chemicals. We see a lot of Vietnamese workers in the food industry, especially those with mom and pop shops. And that might come with food related illnesses or health safe or safety practices inside a restaurant and kitchen, for example, with food fires or things like that. But we also see it in retail as well. So you're communicating with customers. It's that psychosocial aspect. And also with COVID-19, since that was a big thing and a lot of Vietnamese retail stores ended up taking a huge hit because of that pandemic. So there's that service industry in general that nail salons fit in. But another big hub that a lot of people may not necessarily see is the manufacturing or installation or repair industry. And I see this a lot with my current work in the semiconductor manufacturing. So places that make chips or do soldering. So you'll see rows of people who are Vietnamese and speak only Vietnamese be at these soldering stations. And soldering is that's essentially taking metal and melting it so it connects pieces together, really baseline. And so you'll see these people be these Vietnamese workers solder, and then you'll see metal fumes come up. And then that poses a huge inhalation hazard. And so a lot of places are trying to implement things like ventilation right at the source. So it's called a local exhaust ventilation. And it's right at the source. So the fumes would get sucked in right at the source and not necessarily have a chance for the workers to inhale. But it's interesting because I've seen um, rows and rows of people who didn't speak English very well or had no English speaking capabilities and only spoken English or Vietnamese in the workplace, rows and rows of them just soldering or inspecting using microscopes, right? And it's really interesting because they really create their own community within that manufacturing community. And besides manufacturing, there's also repair. So things like automotive mechanics and repair. I see a lot of Vietnamese people tend to flock to that kind of sector, and that has its whole range with like gasoline, ergonomic issues, because it's a hard job, and things like building as well. Um, I haven't seen a lot in construction per se, since it's a very definite Hispanic dominated industry, but definitely like handyman repair. I've seen a lot of Vietnamese people in that industry as well.
Okay, so now that you've kind of given us like a lot of insight into the conditions that nail techs find themselves in, and also the different nuances to all of these different factors that affect um, the responses to even like trying to advocate for themselves, and also some resources that are available to them. I'd like to ask you to conclude this segment. How can public health professionals better engage with the Vietnamese community to address these workplace health issues? Not just specifically within the nail salon industry, but just in any industry in general.
Yeah, I think the first thing is really to understand where the community comes from, right? And this is just not applicable to all Vietnamese Vietnamese population, but to all communities, right? So understand like what's their background, what's their living conditions like, why are they doing this job, right? And you get to talk to these workers, right? And learn their story because it's a terrible feeling when someone goes into a workplace and says, you're not doing this safe, or you should be doing this, when you don't even know what their living circumstances are, right? And so it's important to kind of get to know the workers that you're serving, like, oh, what's your background in, or like, how did you get here, or oh, do you ever notice that you feel sick sometimes when you work? Do you want to talk about it? Things like that, right? Or it's like, oh, are you on any food assistance? Are you at risk of losing your home? Things like that. So just really understanding where the community comes from and having that cultural competency when approaching these workers. And then once you're there, you need to leverage the community and listen to understand, not to just to respond, right? So in that way, you're actually giving power back to the community. You can amplify their voices, but I would encourage you not to speak for them as if you know their struggles unless you have that lived experience. We want to be able to uplift their voices in the community and make their voices known because there's nothing more powerful than hearing these issues and hearing the community advocate for themselves um, in their own language or in their own way, right? And so you can support that and help them be connected with the resources to do that, right? So if for example, there was this thing in New York, the New York Department of Public Health, they actually targeted the nail salon industry and they decided to do these series of interventions to help the nail salon industry, right? And one of the things was that they were saying nail salons need to have certain ventilation requirements in order to reduce exposures, like chemical exposures in the nail salon industry, right? That's a way to control exposures in the nail salons. Ventilation is a big thing, but if you think about it, that intervention kind of failed. And the reason being is because a lot of people with this immense public health background was like, yes, we need to enact ventilation. That's the best way we can reduce exposure. And then when they try to implement it, a lot of nail salons were like, how can we afford that? You're not even giving us money to do this. You're just making it a requirement for us to have proper ventilation. And then even if they're like, okay, we have this small grant that you can apply. Okay, well, how can we apply? We don't know how to use technology. We aren't very fluent in English. We don't even know how to arrange ventilation. Like we don't even understand how ventilation even works. Um, and it's also kind of scary. It messes up the aesthetic of the place if you have just long tubes of ventilation sources, local exhaust ventilation sources, like I mentioned with soldering, just at every single nail station. It looks almost industrial. No one's going to want to visit our shops, right? And so, in part, that intervention wasn't as effective as it was because um, they didn't take into account of a lot of community voices in the first place. They kind of just said, "We know what's best for you, so you just do it," right? And so I think that's important to really leverage and understand your community and say, okay, well, how do you think it would be best to help your workplace? And that might be as simple as putting a portable HEPA ventilation unit, right? That's just like a small unit. It looks like almost a big tube where it's just constantly filtering air. And just explaining to them and training them, oh, every couple months you need to switch out that filter. And if you apply for this grant, maybe they will be able to give you money for you to get that unit and also change out the filter as well, and then they'll provide you training. And so that's something I haven't even seen yet, but something that I thought of that was like, okay, this might be a feasible, low cost um, way for a lot of nail salon workers to maybe reduce their exposure, if anything. And so, yeah, I just really think that we need to come in with a mindset where going to work with the community and be educated all together, not come from a point where, oh, I know this knowledge, and I'm going to feed you this knowledge and expect you to do as I say or follow my recommendations.
Yeah, I really like how you brought up the New York department as a kind of case study to understanding like the true importance and significance of allowing or like amplifying the voices of these communities and the importance of having actually like a lived experience. Um, and I think the whole situation with the ventilation in the New York department, like that kind of just gave me more insight into the different like complexities and the structures of how there are so many different responses to these public health issues, and obviously a lot of them are coming from good places, but it's still really important at the end of the day to truly understand like who you're working with or who you're trying to um I guess improve the quality of life of. But yeah, thank you for your time today, Jacob. I think we're actually running maybe a little over time or right under 30 minutes. But before we end the segment, are there any like lingering comments or questions, Peter or Jacob?
No, that's all good. Thank you, Jacob.
Not on my end, but hope everyone has a good summer and make sure you stay cool with the heat.
All
Okay,
right.
thank you.
Thank you.